Many people begin their fitness journey with a fairly simple goal in mind. They want to look better in the mirror, feel more confident in their clothes, or maybe just have a bit more energy to get through the day. Those are completely valid reasons to start moving your body. But what often surprises people, especially when we start talking in a medical setting, is just how much deeper the impact of fitness actually goes. In clinic, I've had countless conversations with patients who initially came in for concerns that seemed unrelated to exercise. A man might come in worried about changes in his sexual performance. Someone else may be struggling with low energy, weight gain, or feeling like their body just isn't functioning the way it used to. And while these concerns can have many causes, one common thread often emerges quietly in the background: a lack of consistent physical activity and declining muscle health over time. It's easy to think of exercise as something optional, something we'll get to when life slows down. But the reality is that our bodies are designed to move, and when we don't use them regularly, we begin to lose key functions, sometimes gradually, sometimes more quickly than expected. What's particularly important to understand is that fitness isn't just about appearance. It's deeply tied to how long we live, how well we live, and how independent we remain as we age. One of the most overlooked aspects of health is muscle. Many people associate muscle with athletes or bodybuilders, but in medicine, we see it very differently. Muscle is not just about strength or aesthetics. It's a critical organ system that plays a central role in your metabolism, your mobility, and even your hormonal balance. In fact, muscle tissue actively communicates with other parts of the body through chemical signals, influencing everything from blood sugar control to brain function. To put this into perspective, think about everyday activities: getting up from a chair, climbing stairs, carrying groceries, maintaining balance while walking. These are all tasks that rely on muscle strength and coordination. When muscle mass declines, these basic activities can become more difficult. Over time, this can lead to what we call frailty, a state where the body becomes more vulnerable to injury, falls, and loss of independence. Now imagine this in real life. A person in their 60s who once moved easily now finds it difficult to stand up without support. Another individual becomes hesitant to walk on uneven ground for fear of falling. These changes don't happen overnight, but they often trace back to years of gradual muscle loss and reduced physical activity. The good news is that this process is not only preventable, it can often be reversed with the right approach. What's even more interesting is how closely this ties into sexual health, a topic that many people don't immediately connect with fitness. Sexual function, particularly in men, relies heavily on blood flow, hormonal balance, and physical stamina. These are the same systems that are strengthened through regular exercise. When you improve your cardiovascular fitness, you enhance circulation. When you build muscle, you support metabolic and hormonal health. When you stay active, you maintain the physical capacity needed for endurance and movement. In other words, the benefits of fitness extend far beyond the gym. They show up in how your body performs in everyday life, including in intimate moments. This connection is often eye-opening for patients because it reframes exercise from something cosmetic to something deeply functional and meaningful. Another concept that's important to understand is how fitness influences longevity. When we talk about living longer, it's not just about adding years to life, it's about adding life to those years. There's a significant difference between simply being alive and being able to live independently, move freely, and engage in activities you enjoy. Fitness plays a central role in that distinction. Research consistently shows that certain physical markers, like muscle strength and cardiovascular capacity, are strong predictors of how long and how well someone will live. These are not abstract concepts. They reflect how resilient your body is in the face of illness, stress, and aging. For example, the ability to use oxygen efficiently during activity, often referred to as aerobic fitness, is closely linked to overall survival and health outcomes. At the same time, modern life often works against us. Many people spend long hours sitting, whether at a desk, in a car, or in front of a screen. Daily movement has decreased significantly compared to previous generations. Even small things like walking to nearby places or taking the stairs have become less common. Over time, this reduction in movement can quietly impact metabolism, weight, and overall health. And yet, when people do begin to reintroduce movement into their lives, the changes can be profound. I've seen patients who start with something as simple as daily walking and gradually build up their strength and endurance. Over time, they report better energy, improved mood, and even noticeable improvements in their sexual health. These changes don't require extreme routines. They come from consistency and intention. It's also worth addressing a common myth that it's too late to start. This belief can be incredibly limiting. In reality, the human body is remarkably adaptable. Whether you're in your 30s, 50s, or beyond, your muscles and cardiovascular system can respond positively to training. Improvements in strength, balance, and endurance are possible at almost any age, and they can make a meaningful difference in quality of life. As we move forward, we'll take a closer look at the science behind these changes, how exercise influences the body at a deeper level, why it matters for both sexual health and longevity, and what specific elements of fitness are most important to focus on. Because once you understand how your body responds to movement, it becomes much easier to see why even small, consistent efforts can have such a powerful impact over time. Once you begin to look beneath the surface, it becomes clear that fitness is not just a general concept. It's made up of several key components, each playing a distinct role in how the body functions. Two of the most important are muscle health and cardiovascular fitness, and together they form the foundation for not only longevity, but also sexual performance and overall vitality. Let's start with muscle because it is often underestimated. From a medical standpoint, muscle tissue is incredibly active. It doesn't just help you lift weights or perform physical tasks. It also plays a central role in regulating blood sugar, supporting metabolism, and even influencing how your brain functions. When you eat carbohydrates, for example, your muscles act as a storage site for glucose, helping to keep your blood sugar levels stable. When muscle mass is low, this system becomes less efficient, increasing the risk of conditions like insulin resistance and type 2 diabetes. There's also a protective effect that muscle provides. During times of illness or stress, the body can draw on muscle stores to support recovery and repair. In this sense, muscle acts almost like a reserve system, helping you withstand challenges more effectively. Without enough of it, recovery becomes slower and the body becomes more vulnerable. Now, if we connect this back to sexual health, the relationship becomes easier to understand. Erectile function depends heavily on healthy blood vessels and proper circulation. Conditions that affect blood flow like diabetes, obesity, and cardiovascular disease are also strongly linked to reduced muscle mass and poor metabolic health. So when you improve muscle quality and metabolic function through exercise, you're also indirectly supporting the systems that allow for healthy sexual performance. Cardiovascular fitness adds another critical layer. This is where the concept of how efficiently your body uses oxygen comes into play. When your heart and lungs are able to deliver oxygen effectively during physical activity, your endurance improves. This doesn't just help during workouts, it translates into everyday stamina, including during sexual activity, which is often comparable to moderate intensity exercise in terms of physical demand. There's a measurable way to assess this, often referred to as aerobic capacity. While most people won't need formal testing, the concept itself is important. Individuals with higher cardiovascular fitness tend to have better overall health outcomes, including lower risk of chronic disease and improved physical performance. On the other hand, low cardiovascular fitness is associated with fatigue, reduced endurance, and increased health risks. In practical terms, this means that someone who gets easily winded climbing a flight of stairs may also struggle with stamina in other areas of life. Conversely, improving cardiovascular fitness through regular activity, like brisk walking, cycling, or swimming, can enhance endurance across the board. Another aspect that often gets overlooked is how movement patterns and physical strength influence real-life function, including during intimacy. Sexual activity isn't static. It involves coordination, flexibility, and strength in various muscle groups. The hips, core, and lower body all play a major role. Limited mobility or weakness in these areas can not only affect performance, but also increase the risk of discomfort or injury. It may sound surprising, but injuries related to physical strain during intimacy are not uncommon. Lower back pain, muscle strains, and joint discomfort can all occur when the body isn't adequately prepared for certain movements. This is why exercises that improve hip mobility, core stability, and overall strength can have very practical benefits beyond the gym. For example, strengthening the glute muscles, the large muscles in the hips, can improve both power and control in movements that require thrusting or sustained positioning. Core muscles, which include the abdominal and lower back muscles, help stabilize the body and protect the spine. When these muscle groups are well conditioned, movements become more efficient and less likely to cause strain. Balance and coordination are equally important, especially as we age. The ability to maintain stability, react quickly, and control movement can prevent falls and injuries in daily life. These same qualities also contribute to confidence and ease of movement in more dynamic situations. Training balance doesn't require anything complicated. It can be as simple as practicing controlled movements, walking on uneven surfaces, or engaging in activities like yoga or dance. There's also a neurological component to all of this. When you practice specific movements repeatedly, your brain becomes better at coordinating them. This is known as motor control. If you want to improve at a particular activity, your body benefits from actually performing movements that are similar to that activity. This is why functional exercises, those that mimic real life movements, are often more beneficial than isolated, repetitive motions that don't translate into everyday function. Now, when it comes to building an effective fitness routine, the research consistently points to a combination of strength training and cardiovascular exercise. Strength training, performed a few times per week, helps build and maintain muscle mass. This doesn't mean you need to spend hours in the gym, even shorter. Focused sessions can be effective if done consistently and with proper effort. Cardiovascular activity complements this by improving heart and lung function. Moderate intensity activities, where you're slightly out of breath but still able to speak, are particularly beneficial for building endurance. Over time, these activities improve your body's efficiency and resilience. An often underestimated factor in all of this is what happens outside of structured exercise. The movement you do throughout the day, walking, standing, fidgeting, doing household tasks, can significantly impact your overall energy expenditure. This is sometimes referred to as non-exercise activity, and it varies widely between individuals. Some people naturally move more, while others have more sedentary routines. Increasing daily movement, even in small ways, can make a meaningful difference in overall health and weight management. Sleep is another critical piece of the puzzle. Without adequate rest, the body struggles to recover from exercise, regulate hormones, and maintain energy balance. Poor sleep can lead to increased hunger, reduced motivation to exercise, and impaired performance. Over time, this creates a cycle that can be difficult to break. On the other hand, consistent, high-quality sleep supports muscle growth, improves mood, and enhances overall physical function. When you step back and look at the full picture, it becomes clear that fitness is not about one specific activity or outcome. It's about creating a system within your body that functions efficiently and reliably. Muscle supports metabolism and strength. Cardiovascular fitness supports endurance and circulation. Movement patterns support coordination and injury prevention. And sleep allows all of these systems to recover and adapt. As we move into the final chapter, the focus will shift toward how to bring all of this together in a practical, sustainable way, how to build habits that fit into real life, support long-term health, and ultimately help you feel stronger, more capable, and more confident in your body. When all of this information comes together, it can feel like a lot to take in. Muscle health, cardiovascular fitness, mobility, sleep, nutrition. It may seem as though optimizing your health requires a complete life overhaul, but in reality, the most effective approach is often much simpler and far more sustainable. It's not about doing everything perfectly. It's about building a rhythm of habits that support your body consistently over time. The first and most important shift is how you think about fitness. Instead of viewing it as a temporary effort, something you do for a few weeks to achieve a short-term goal, it helps to see it as part of your long-term health strategy. Just like brushing your teeth or getting enough sleep, movement becomes a non-negotiable part of taking care of yourself. When you adopt this mindset, the pressure to be perfect fades, and what matters most is simply showing up regularly. A practical starting point for many people is strength training a few times per week. This doesn't require a complicated routine or expensive equipment. The goal is to challenge your muscles in a way that encourages them to adapt and grow stronger. Movements that involve multiple muscle groups, such as squatting, lifting, pushing, and pulling, tend to be the most efficient because they mirror how your body naturally moves in daily life. Over time, gradually increasing the difficulty, whether by adding weight or doing more repetitions, signals your body to continue improving. Alongside strength training, incorporating regular cardiovascular activity helps build endurance and supports heart health. This doesn't have to mean intense workouts. In fact, one of the most underrated and accessible forms of exercise is simply walking. A brisk walk done consistently can improve circulation, support metabolism, and enhance overall energy levels. For many people, this is the easiest way to begin building a foundation without feeling overwhelmed. As your fitness improves, you can layer in more variety, perhaps cycling, swimming, or short bursts of higher intensity activity. The key is to find forms of movement that feel sustainable and even enjoyable. When exercise feels like a punishment, it becomes difficult to maintain. But when it fits naturally into your routine, it becomes something you're more likely to continue. Another essential piece is paying attention to how much you move outside of structured workouts. Daily activity, things like taking the stairs, standing more, or walking short distances instead of driving, adds up in powerful ways. These small movements may not feel significant in the moment, but over the course of days and weeks, they contribute meaningfully to your overall health and energy balance. Nutrition also plays a supportive role in this process. You don't need to follow extreme diets or eliminate your favorite foods. Instead, the focus should be on balance and awareness. Understanding how much you're eating and where your calories are coming from can be incredibly helpful, even if you only track your intake for a short period. Many people are surprised to learn how small adjustments, like increasing protein intake or reducing highly processed foods, can improve both body composition and energy levels. Protein, in particular, is important for maintaining and building muscle. Including a good source of protein in your meals helps support recovery after exercise and keeps you feeling satisfied. At the same time, healthy fats and carbohydrates provide the energy your body needs to function well. Rather than labeling foods as good or bad, it's more helpful to think in terms of overall patterns. Consistency in balanced eating tends to produce better results than strict, short-lived restrictions. Weight management, if it's a goal, also benefits from this steady approach. Sustainable progress usually comes from modest changes maintained over time, not from extreme calorie cuts or intense short-term efforts. Allowing flexibility, what some people think of as following a plan most of the time while leaving room for real life, can make a significant difference in long-term success. Sleep, often overlooked, is where much of the body's recovery actually happens. When you get enough high-quality rest, your muscles repair themselves, your hormones stay balanced, and your energy levels are more stable. On the other hand, poor sleep can make everything else harder. It can increase cravings, reduce motivation to exercise, and impair physical performance. Protecting your sleep is in many ways just as important as the workouts themselves. It's also important to acknowledge the emotional side of this journey. Progress is rarely linear. There will be weeks when you feel strong and consistent, and others when life gets in the way. That's normal. The goal is not to avoid setbacks entirely, but to return to your routine without guilt or frustration. Each time you come back to your habits, you reinforce a pattern that supports your long-term health. When we bring this back to sexual health and longevity, the message becomes very clear. A body that is strong, well-conditioned, and well-rested is better equipped to perform, not just in the gym, but in all aspects of life. Improved blood flow supports erectile function. Better endurance enhances stamina. Stronger muscles and improved mobility allow for more comfortable and confident movement. And perhaps just as importantly, feeling physically capable often translates into greater self-confidence and overall well-being. Imagine the difference between feeling limited by your body and feeling supported by it. One creates hesitation and frustration. The other creates confidence and freedom. That transformation doesn't come from a single workout or a perfect diet. It comes from the accumulation of small, consistent choices. In the end, fitness is not about chasing an ideal version of yourself. It's about building a body that allows you to live your life fully with strength, independence, and resilience. Whether your goal is to improve your health, enhance your sexual well-being, or simply feel better day to day, the path forward is built on simple, repeatable actions. And perhaps the most reassuring part of all is this: you don't have to do everything at once. You just have to stay consistent, and trust that over time, those efforts will add up in ways that are both meaningful and lasting.